Hello, today I'll discuss about a few MCQs in the 8th cranial nerve or vestibulocochlear nerve. Let's solve some multiple choice questions from the 8th cranial nerve. So question number 1, a 45-year-old man has episodic tinnitus, that is buzzing or some type of roaring sound inside the ear, vertigo, hearing loss, that means deafness, and a sense of fullness of his ear accompanied by nausea and vomiting. What is your provisional diagnosis? Okay, so the choice: Meniere's disease, benign positional vertigo, acoustic schwannoma, medial longitudinal fasciculus syndrome, multiple sclerosis. Okay. Second question, which of the following nerves are connected by the medial longitudinal fasciculus? Okay, our choice are the first cranial nerve, second cranial nerve, third, fourth, and sixth cranial nerve, the fifth cranial nerve and seventh cranial nerve, ninth cranial nerve and the 10th cranial nerve, 11th cranial nerve and the 12th cranial nerve. Okay. The vestibulocochlear nerve emerges from the anterolateral aspect of the pontomedullary junction and enters the temporal bone through which foramen lacerum, foramen spinosum, eustachian tube, internal acoustic meatus, hypoglossal canal. Okay, we got 5 questions. So here, the question number 5, organ of Corti is connected to the peripheral processes of the bipolar neurons of the spiral ganglion. The organ of Corti is located where? Semicircular duct, utricle, endolymphatic sac, saccule, cochlear duct. Okay, so these are the 5 questions. We have to find out the answers. Let's start one by one. This is the question. Tinnitus, vertigo, hearing loss, these are episodic, and sense of fullness may be accompanied by nausea and vomiting. What should be the provisional diagnosis? It should be Meniere's disease. This deafness is a sensory neural deafness, and this may be episodic, ultimately may be permanent. Answer is the Meniere's disease. A is the answer. Which of the following is an inner ear disease associated with increased endolymphatic fluid pressure? Look at that. Endolymph. It is present in the membranous labyrinth, and that may be increase in amount, that fluid that may congest the area, and this is the feature of the Meniere's disease. It is the possible cause of Meniere's disease, excessive endolymphatic fluid collection because its drainage is blocked somewhere, or its reabsorption is altered. So answer should be Meniere's disease. Which of the following nerves are connected by the medial longitudinal fasciculus, third, fourth, and sixth nerve? These nerves are also connected to the 8th cranial nerve, vestibulocochlear nerve. These all 3 nerves supplies the extraocular muscles. So there may be chance of nystagma in case of medial longitudinal fasciculus syndrome or in case of vestibular dysfunction. Vestibulocochlear nerve emerges from the anterolateral aspect of the pontomedullary junction, lateral to the facial nerve, okay, and enters the temporal bone through which? Through the internal acoustic meatus. Okay. It does not come out of the temporal bone. It is confined to the temporal bone. Number 5, the organ of Corti is connected to the peripheral processes of the bipolar neurons of the spiral ganglion. The organ of Corti is located where? Semicircular duct, utricle, endolymphatic duct, saccule, cochlear duct. Answer should be cochlear duct, also called scala media. You'll get the organ of Corti. It is composed of hair cell. You have the basilar membrane, sharpened membrane, membrana tectoria, that is above it. So that is the organ of Corti, and it is located in the cochlear duct. Okay, and that's all about the MCQs in the vestibulocochlear nerve. If you have any question, please feel free to ask me. Please share the MCQs with your friends and have a nice day. Bye now.